If you have been dedicated to your diet and you've been doing crunches, but you still cannot seem to shake that persistent postpartum pooch, you are likely feeling incredibly frustrated. You feel like you are fighting a losing battle, and I am here to tell you that it is not your fault. That bulge is not fat. It is a fundamental anatomical issue that no amount of crunches can fix. So, what exactly is happening under the surface? We need to look at this from an anatomical perspective. The issue is called rectus diastasis. This is the separation of your two vertical six-pack muscles, the rectus abdominis muscles. This happens when the connective tissue that runs down your center line, called the linea alba, stretches and breaks down. And during pregnancy, the growing uterus pushes outward, stretching this tissue significantly. When these muscles separate, your core structure is weakened and internal tissue can push forward, creating that noticeable bulge. Is rectus diastasis only an issue for folks who have been pregnant? The short answer is no. While it is certainly most common after pregnancy, men can also develop rectus diastasis. This typically happens due to significant weight changes or age, which can cause excessive or chronic straining on the abdominal wall. So, while we often call it a mommy tummy, it is a core structural problem that can affect many folks. How do we start to fix this functional problem? In our practice, for mild cases, the first step is specialized physical therapy. I stress that word, specialized. You need targeted work focusing only on engaging your deep inner core muscle. And we also have awesome modern non-surgical solutions. We use technology like Emsculpt Neo, which can non-invasively help improve rectus diastasis by an average of about 19%. This is an exciting option for people with milder separation. But what if the separation is moderate or severe? When the separation is more significant, especially if it is causing associated functional problems like chronic back pain, reduced abdominal strength, or even incontinence, surgical repair is the gold standard definitive solution. This repair is called rectus plication or muscle repair, and we perform it during an abdominoplasty or tummy tuck. The surgeon physically stitches those separated muscles back together, restoring the strong, flat foundation of your core wall. It is absolutely critical to understand that the tummy tuck in this context is far more than just a cosmetic procedure. It is a functional repair to restore core strength and stability. And it follows that restoring that core stability often leads to improvements in those functional issues like back pain and incontinence. So the key takeaway here is that the bulge is often an anatomical issue, not a weight issue. If you suspect you have rectus diastasis, get in touch with our team. We are happy to answer any questions you may have.